Welcome back in our Columbus region. Today, we have a special guest joining us in this studio. Senator Bill Cassidy, who is here to discuss an exciting initiative that aims to revolutionize our healthcare system called Make Health Tech Great Again. Good morning, Senator. Thank you for coming on.
Hey, good to be with you. Good morning to everybody who's watching. By the way, the Great Healthcare Great Again. It was announced yesterday at the White House. I was on the front row, me and another senator. The president was right there, and he was discussing how he can how we can get our access to our medical records, no matter where you go, to give the patient the power. The president has gotten together everybody who's involved with this. This is their initiative. It's great news for patients. As a doctor who takes care of people, I am incredibly pleased.
All right, and Senator Cassidy, I know you kind of already briefly touched on it, but how does this aim to transform the current healthcare landscape?
So right now, if you go to a hospital in your hometown, and then maybe you go out to Utah and you get hurt, and then you go to a small town in Louisiana, say you go to Opelousas, those records don't necessarily communicate. Now, when Obamacare passed, hundreds of billions of dollars were put to make that happen. Didn't happen. So President Trump is like, man, if he says you better show up at the White House, people show up. And so we've got the leading hospital systems, the leading medical records people, the leading tech companies came together, and he got them to agree to come up with a way that wherever you're seen, that record goes to a master file. It will be on your phone, no government database, but it'll be here. And next time you go to a doctor, you can present your records to the doctor wherever you are. She can pull them down, look at them, and say, this is your problem. We're going to treat it. It's a great advance. I'm looking forward to supporting the president on this.
Nice. Senator Cassidy, it almost sounds like the My Health chart right there, a little more expanded version of that. But how will this lead to improved patient outcomes?
So if you think about it, sometimes what happens in that hospital in Utah has a direct impact upon what happens to you when you go to the emergency room in Opelousas or to your hometown in Monroe or West Monroe. And so if you can coordinate all that, one is fewer tests, and two, the doctor may say, wait a second, look at that test way back here in that hospital. That's the direction we should be going in. As a physician, I can tell you it's invaluable.
How will the administration gather feedback from healthcare providers and patients? And this is just to ensure that, technologies, their developments, the needs are being met with that. How is that exactly going to happen?
The president is so crazy that if he calls people up and say, you better be at the White House on Wednesday, they show up because they think if they're not at the White House, they'll be on the menu. And so they came, and he got them to give a voluntary agreement. Now, by the way, that voluntary agreement may only last as long as he's the president. I'm the chairman of the committee which is in charge of this issue. And so I'm committed to working with the president, with his administration, to not only have them do it voluntarily, but to put in the legal protections if they do it, and then to put in the requirements that they continue it ongoing. So it's my privilege to work with the president to make sure that this action, which gives power to patients, power to you and me, comes into law, not just voluntarily, but by, my gosh, you got to do it even if you don't want to sometimes.
All right, well, Senator Cassidy, thank you so much for joining us here on our morning show. It's been a pleasure to speak to you, and just thank you so much for informing all of our viewers, as always.
Hey, it's always great to be with you. Thank you.